Hi, my name is Mohammed Shullah. I'm a first-year radiology resident at John H. Georgia Hospital. I'll be presenting a transgender female appearance on various modalities. Transgender is an umbrella term for any individual whose gender identity or internal sense of self related to gender differs from the sex assigned at birth. A non-binary individual may be assigned female or male at birth, but does not strictly identify with either sex. For example, a trans feminine person is someone who was assigned male at birth but identifies as a female, and a trans masculine person was assigned female at birth but identifies as a male. These are some other important things to be aware of. For example, top surgery is reduction or mammoplasty or mastectomy, sometimes done to remove breast tissue to have a more of a masculine figure. We reviewed cases of transgender females from the Ruth M. Rothstein Core Center by reaching out to the providers at the Core Center. They referred cases to us which met the criteria of transgender female patients who have undergone breast augmentation, either hormonally or surgically. We searched our radiology database for the breast imaging and reviewed the imaging appearance of the augmented breast in the transgender female patient. This system of retrospective review was reviewed by reaching out via email to the providers at the Core Center for the patients that fit these criteria, as the electronic medical records in both the clinic and in radiology do not have a definite method of identifying transgender females. I'll be going over a few cases of the appearance on imaging of transgender female breasts, either enhanced through hormone treatment or surgery. This first case, these are mammographic images of both breasts. This patient was on hormonal treatment for more than 5 years. She had come to breast imaging due to a palpable lump. The breasts are extremely dense, as you can see on both sides equally. There were no suspicious masses, calcifications, or architectural distortion. This imaging here is indistinguishable from a cisgender female of typically younger age, usually less than 30 or 35. This is an ultrasound. There is a heterogeneous echotexture. This patient was on hormonal treatment for more than 5 years. She had come to breast imaging due to a palpable lump. No ultrasonographic evidence of a mass or cystic lesion was identified. This imaging is, again, indistinguishable from a cisgender female, just identifying regular breast tissue. And this here is an MRI of the breast. This patient had bilateral retropectoral silicone implants. These are surgical procedures done to, again, enhance the female attributes of a breast. There are bilateral intracapsular rupture, which you might see also in cisgender females that have implants. So this is the implant itself, and this darker edge to it is the capsule, and beyond that capsule there is silicone, which would be identified as a silicone rupture that can be seen again in cisgender females, however this being in a transgender female. So we just reviewed 3 cases of transgender females who can present to a breast imaging clinic with pathology that you might, not just pathology, but also regular tissue that can also be very similar to a cisgender female. And transgender females, they may augment their breasts either hormonally or surgically with implants. And if they have received more than 5 years of hormone treatment, a good recommendation to follow is that breast cancer screening should be similar to cisgender females. My name is Mohammed Shullah, and if you care to contact me, this is my email here. Thank you for taking the time for watching my presentation.